I do believe there is certain reverence, certain magic, certain intangible quality that we can really not quantify when we present ourselves in front of a patient who's in pain, who has a lot of problems, who's actually suffering because of their disease process. And knowing that your skill level, your ability as a caregiver can make a difference in that patient's well-being. It's an incredible feeling of professional contentment. That's why we cannot really attach a price tag to that. There is no paycheck in the whole wide world that would fulfill that type of a professional contentment, because the intervention is immediate and the result is immediate. The moment we relieve the pain and the discomfort of a patient, the reward is surreal. That's why I still consider being a caregiver the most noble profession in our society, because the need is immediate and it's immediately relieved. The most important component about that is, though, convincing the patient, which is trust, convincing the patient the caregiver will make a distinct difference in their disease process and the way they feel. And no caregiver will be able to provide that unless they can convince themselves that they can walk into a patient's room and make a distinct difference. As a care provider, I don't even walk into a patient's room before convincing myself that I'm going to make a difference in their status. And that's the magic of being a caregiver and healthcare provider.